from this to this and then to this. Growing up is an interesting process. I mean, how do you explain all these changes? From a tiny little creature that can barely do anything for itself to a fully grown man who is ready to conquer the world, and then going back to that second childishness, as Shakespeare put it. We all go through important changes, but sometimes things don't go as planned. Abnormalities and diseases can happen at any stage of life. That's why it's important to do some routine medical checkups to make sure everything is okay and to catch these abnormalities early and prevent potentially life-threatening diseases from developing. In this video, we are going to look at all these routine medical tests for every stage of life. Oh, and in order to make things plain and simple, we'll only look at men for now. Then in a later video, we're going to focus on women. Let's start with the very first stage of life, childhood. Let's give it 0 to 12 years. Let's call this the foundational stage. This is a stage where there's rapid growth and development, the body is building its immunity, and early behavioral and cognitive development are also just starting. The recommended health tests for this stage include vaccination schedules to protect against infectious diseases. There's also vision and hearing screening, and the reason for that is to detect early issues that can affect learning and development. Developmental milestone checkups are also important. These will include screens for autism, ADHD, speech delay, or motor disorders. And in some cases, you might have to do lead level testing, especially if you live in an area where lead levels are high. This is because lead exposure can affect cognitive and neurological development. The next phase of life that comes after this is adolescence. This is anywhere from 13 to 19 years. There are a lot of important changes that are happening in the body at this time, things to do with hormonal stages as the person enters puberty, brain development, identity formation. At this point, we also start seeing increased risk-taking behavior. The recommended health tests for this phase of life include annual physical exams. This is to track growth, puberty status, and early signs of health issues. Mental health screening also becomes important so that we can detect depression, anxiety, and substance use. And then there is STI screening. This is just to catch it early so that treatment can be started early to prevent complications and spreading. There's also scoliosis, which we can screen for during this phase of life. It's common during adolescence as growth is increasing so that it's caught early and prevented from worsening. The next phase of life that comes after this is young adulthood, 20 years to 39 years. This is the age of peak physical health and fertility. At this stage, a lot of lifestyle choices are made, from what type of diet you adopt to questions with regards to exercise, smoking, drinking. All these are things that will shape one's future health. Recommended tests for this age include blood pressure checkups. This is for early detection of hypertension, which, as you may be aware, is often silent until it strikes with severe consequences. Cholesterol and lipid checkups can also be started at this stage. This is to prevent early onset of heart disease. But actually, cholesterol and lipid tests can even start as early as 20 if other risk factors are present. Other tests will include HIV and STI screening, BMI and waist circumference checkups. Apart from that, diabetes screening has to start early. This is in order to prevent complications from undiagnosed type 2 diabetes. And then we can throw in annual skin checkups in order to detect early melanoma or other types of skin cancer. From young adulthood, the next stage is 40 to 59, which is also known as the middle age. At this stage, overall metabolism has started slowing down. There's reduced testosterone. there's muscle mass loss and increased cardiovascular risk. This stage also comes with higher stress and chronic disease onset. As a result of this, the recommended tests for this stage of life will be in line with chronic diseases. These tests will include tests like prostate-specific antigen test. This one screens for prostate cancer, especially if there is family history. We can also throw in colonoscopies, which normally start at 45, and this is for early detection of colorectal cancer. We also have cardiovascular screening, which includes stress tests, ECGs, among other things. Diabetes screening can also continue in this phase of life. Other tests include thyroid function tests, liver function tests, and even mental health and cognitive screening. And then we now get into the senior years, 60 and above. This is a stage where everything slows down. There's frailty all over, slower healing, cognitive changes, and even bone density loss, not to mention an increased risk of cancer, heart disease, and dementia. Recommended health tests in this final phase of life include bone density scans to help detect osteoporosis and fracture risk, annual vision and hearing tests, as these may affect safety, cognition, and quality of life. And since neurodegenerative diseases such as Alzheimer's are more common during this phase of life, annual cognitive screening is also important. Other tests include aneurysm screening, colonoscopy, and prostate cancer screening. Remember that second childishness that we mentioned earlier? It comes at this stage of life. This means that immunizations should be part of the plan in order to support the weakened immune system. Apart from these stage-by-stage medical tests, there are other lifelong tests that may be needed across all ages. These include things like dental checkups, eye exams, sleep assessments, and allergy testing. If you've made it this far, then you are enjoying our content. Please consider liking, sharing, and subscribing. See you in the next one.